Hello everyone, my name is Dr. Adenike Eketunde and you're watching Health Domain. On this show we'll be talking about health and general well-being, and today's topic is child sexual abuse. It is a very important topic because 1 out of 4 girls are being abused and 1 out of 10 boys. This is very ridiculous, and we have a special guest. He's a psychiatrist and he has been doing this for almost a decade. He's going to be enlightening us and educating us about child sexual abuse. Don't go anywhere, keep watching. We'll be right back.
Well, hello viewers. My name is Dr. Afolabi. I'm a mental and behavioral health practitioner. I practice here in Lagos, and I'll quickly talk about sexual abuse in children. Sexual abuse is a very common practices in our day-to-day life, and is very common. There are a lot of people who are vulnerable to this abuse. Underage children, for example, people who engage in street hawking, and also who also engage in child labor are predisposed to this. I would encourage viewers who are parents to have high index of suspicion when you have a lot of adults who always attach to your children, who always get involved than usual with your children, who want to have a time out or a separate or a private time with your children, and so you should be very involved in whatever they do. As a parent, you must be have high index of suspicion. You must be vigilant. You must be interested in what goes around your children. You hold your children that responsibility. Thank you very much.
Welcome back. You're still watching Health Domain. Like I said earlier, we have a very special guest. He's a psychiatrist and he has been doing it for almost a decade. Welcome, Dr. Afolabi.
Thank you very much. It's good to be on the program.
We are very pleased to have you here. Can you tell us about what you do? Let's start with that.
Okay, I'm a mental and behavioral health practitioner, where we deal with different range of mental health issues, but on probably psychosis, affective disorders, look at the childhood psychiatric disorders, and sexual disorders, and a host of others.
Okay, and today's topic is sexual abuse in children.
Okay.
So can you tell us what is sexual abuse?
Okay, that's a very interesting topic. A child that is under the age of consent, the consenting age, that is the age at which the child can consent to a particular behavior. If that child is actually exposed by somebody by act of omission or commission to any activities that is actually expected to increase sexual arousal, or actually leads to sexual gratification in that person or other group of people or network of people, is being considered as child sexual abuse in children. And this definition still hold if whether or not the action or the act was actually initiated by the child, or whether or not there was a genital contact or not.
Okay, going about the child sexual abuse, at what age would you consider it as child sexual abuse? Is it 18? Is it 15 in Nigeria?
Okay, well, it is a bit of a controversy when it comes to consenting age in Nigeria, because if you look at the country as a whole, we have the north and the south. These are two different set of people who have different beliefs in terms of cultural and religious belief. Some believe that younger children can be married, while south here, coming down south here, we believe that the child should be a bit older. Now, coming to the law that actually guide this, looking at the penal code, I think the child, the consenting age was actually stipulated at age that's above 11 years. But recently, about 3 years ago, a bill was passed about the sexual offense bill, which actually stipulated that the child, anybody that has sex with a child or adolescent below the age of 18 years, actually violated this this sex
So
offense.
it is a criminal offense.
It's actually a criminal offense that is actually punishable by life imprisonment. But this law, where there was a bit of controversy as regards this bill, was that now there was actually divided into separate parts. Like there was an aspect of the bill that talk about age below 11 years, punishable by life imprisonment. There was also another aspect of the bill that also talk about between 12 to 15 years. If you have any sex with anybody between 12 to 15 years, life imprisonment. Then there was another one that was like between 16 to 18. So people were confused as okay, what are they actually saying? But some lawyers have actually come forward to interpret this that okay, it's actually from the age of 18 years and below. That if you have any sexual relationship with children, that is punishable by law.
So what are the signs and symptoms that people will see or the child will exhibit to show that this child has been molested or has been abused?
Okay, now the signs and symptoms, or the signs are actually what you can see. I would actually look at it from the physical sign that you can see, and also the psychological or the behavioral sign that you can see. From the physical sign, you will look at the child. You will see unexplained sores or bruises on this child, especially really, I mean, very close to the thigh, to the genitalias, maybe the anus. You could see it around the vagina if you take a close look at those child. Sometimes around the mouth, where probably was a form of a oral sex that the person must have had with this child. Okay, so those are the signs. Now sometimes it could also be pregnancy that actually point to a child abuse, sexual abuse on a child. Then coming to the psychological and the behavioral signs that you see in a child. You might see a child maybe that might just have unexplained fear towards an individual. He will be the child will be afraid, will be avoiding that particular individual. Now the child will not want to be left alone with that individual, and also the child will just have a kind of like a change in sleeping pattern, start having nightmares, start having some bad dreams, shouting from from sleep. The eating pattern could also change, where they might have eating disorders of sort. So a very observant mother or a physician would these are the things that would become going through his mind, that could this child be molested or being abused.
Okay, so what are the things that predisposes these children to sexual abuse?
Oh yes, that's very important. A lot of factors could predispose a child to sexual abuse. I would say one of them is um, poverty and deprivation. What do I mean by this? When there is poverty, that is when you see children um, being hawking on the streets. Okay, some of them are homeless, and that's how they will be exposed to all sort of sexual assault on the streets. Then also the cultural practices, as well as the religious beliefs and practices in this part of the world, also encourage um, sexual abuse. When you have maybe a marriage that involve a minor, for example, definitely you would know that that kind of child will be exposed to sexual abuse. And it's very important to say at this point that even when there could be some form of abuse when you're in a relationship. For example, in a relationship where there is a adult and a minor, definitely that minor will not have a say in that relationship. So the adult will just be subjecting that child to all sort of treatment.
Okay, thank you so much, Dr. Afolabi. We're still talking about sexual abuse in children. Don't go anywhere. We'll be right back. Welcome back. We're still talking about child sexual abuse with Dr. Afolabi.
Thank you very much.
Okay, talking about child sexual abuse, what are the long-term effects of this, and how does it affect their sexuality in future?
Okay, thank you very much. Child sexual abuse generally definitely have effects on the victim, both on the short and long term, and the effects could be physical and also could be psychological. Usually, the physical complication, those one are actually what you can see almost immediately. For example, you will see the child, there will be some laceration maybe the vaginal laceration, where it could actually result in to low bleeding, and that could be fatal if the bleeding is not well controlled on time, is not stopped on time. Then also could be also that could also lead to the anal complications where there could be prolapse, anal prolapse of the child because that child is there is a forced penetration, and that could also actually affect the anal sphincter, which could lead to prolapse or rectal or anal prolapse. Then also,
Isn't
that could also
the tissue around the anus comes down.
yes,
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 it's
well,
weak.
yes, because the sphincters actually hold
The
the physics or
yes,
control it. So some of the time it won't be able to like hold the physics again. Then some part of the tissue around that, and especially the rectum, could actually
come out.
come out. Okay, and then also that could also be, which is very common in this part of the world, this VVF, that's vesicle of vaginal fistula. Okay, which is a very common complication in the northern part because we have female child married in that part of the country. So that's why it's very very common. And then also in the long term, because in the process of probably the person, the perpetrator actually discharges probably the sperm into the mouth of this child, then down to the esophagus, it could lead to some changes in the epithelium in the esophagus, which could lead to some esophageal uh, malignancy later on in life, and also in the anus as well. When the sperm is then being discharged to the rectum, that aspect too could also undergo some changes, which could lead to tumor in some people later on in life. And then now coming down to the
Sex.
psychological issue or the complication that they may face. It could be immediate, could also be maybe a long term effect. Usually, you might see this people, they tend to be irritable sometimes, and then sometimes they tend to have to be withdrawn from people for no reason, and they lose interest in things around them, which might eventually lead to depression. And most importantly, it's actually affect their self-esteem. And where they have low self-esteem, you see some of them they have very low self-esteem, which in the long run might actually affect their sexual life. Some of them might, because of that, become very promiscuous and start having sex because they are very angry with at themselves, and then they just keep having sex indiscriminately. And some of them might have a withdrawal from social life. They don't even want to see opposite sex. Okay, and that is why most of them would not even be interested in opposite sex at all. And then some of them, even while trying to in attempt to have sex, they might have what we call psychological vaginismus, where there is spasm of the wall of the vagina, such that it will be so painful to that individual having will be having pain while having sex. Even the other person, even that is having sex with the person, would also be having very difficulty in penetrating,
Penetrating.
or while even having sex with that person would also be having pain. So the person will not even enjoy sex anymore. So as a result of that, they have this passion for sex.
So does this also affect the people they are attracted to, like their sexuality in terms of whether they are attracted to guys or girl to girl?
Well, I would not tell you categorically that because they actually are molested when they were small, that was why they actually affect their sexuality in terms of maybe becoming gay or lesbian. But I've seen instances where some of them actually own up that while I was in secondary school, I was molested. Okay, and then that was why I don't want to see a male, or I don't want to have anything to do with male, because that brings that experience like PTSD, for example, post-traumatic stress disorder, that you experience, you relieve that experience and result in anxiety in them. So that's why some of them. But the reason why I won't tell you categorically, because most of the studies that have been done in this field have not been conclusive. Some study will say, okay, yes, it's actually because of that. Why some studies,
I see.
yes, would say otherwise. So that's why I cannot tell you categorically. Okay, but in terms of sexuality, a lot of factors actually have been actually put forward in terms of sexuality in an individual. Some of them have been linked to genetics, okay, and some of them have been linked to maybe the experience in sexual abuse in the past. But all these have not really be categorical, okay. So that's why I won't say openly, I mean outrightly, that oh, it's as a result of the sexual abuse I was in the past. But some of them actually own up and tell you that oh, I was abused in the past. That's why I don't trust the male sex again. So I actually am more at home